Hi everyone, my name's Shawana Andrews. I'm the Associate Director of the Poche Centre for Indigenous Health. I'm a Trawulwai woman from northeastern Tasmania and presenting to you some of the work that we're currently doing at the centre. I'd like to introduce to you my colleague, Odette Mazel, who is our Senior Research Officer and who will be presenting some of our research findings today. First, I'd like to acknowledge country. I begin by acknowledging the lands, water and all that is tangible and non-tangible, which makes up Wurundjeri country, upon which Odette and I live and work, and Yorta Yorta country, upon which this conference is usually held. And I acknowledge all community and elders. So the Poche Centre was established in 2015 using a philanthropic donation from the Poche family, and I'd like to take this opportunity to acknowledge our benefactors Greg Poche and Kay Van Norton Poche. It's an independent academic centre within the Medicine, Dentistry and Health Sciences faculty of the University of Melbourne. We form part of the Poche Indigenous Health Network, which encompasses sister Poche centres at Flinders University and the universities of Sydney, Queensland and Western Australia. This is our team. We have recently gone through a restructure, so there's a few comings and goings. And for those of you who know Professor Sean Ewan, he was our inaugural Poche Centre Director. Sean has recently left us and will be leaving the University of Melbourne later this year as well. So what do we do? Our vision is to accelerate the development of Indigenous leadership, fostering the emergence of the next generation of Indigenous leaders. So we do that with two overarching strategic goals. The first is building executive leadership, and we do this through a program that encompasses a specific leadership program and then a subsequent alumni and networking program, bringing Indigenous health professionals from around Australia together to develop their leadership skills and equip them with an established network in order to support their progress as emerging Indigenous leaders within the health system, and also equipping them with the skills to be change makers within their disciplines. The second strategic goal is supporting academic pathways, and we do this through our PhD familiarisation program. This is a program targeted at prospective students who are interested in doing a PhD. And we also do this through community partnerships and partnerships with our university institute partners. The process for this is really developing tailored recruitment, establishing strong engagement with our individual PhD students, supporting them through system navigation, and assisting them to enrol and manage their candidature. Another element of this is to support PhDs to develop an international profile through attendance at international conferences and networking opportunities. So our leadership program is really working towards a comprehensive leadership model that supports a national and international narrative that articulates Indigenous health leadership and its place in health and higher education. So we've run the program 4 times over the last 5 years. We have 30 plus alumni from all over Australia and 11 current fellows. It's an annual program, and as I mentioned, it's really targeted at building a network of Indigenous health professionals such that we can support one another and establish a high-profile Indigenous health leadership mechanism across the country and internationally. So our Student Pathways program Currently, we have 27 enrolled PhD students within our medical faculty. Many of these have come through our familiarisation program. And a large component of our work is understanding the pathways for Indigenous PhD students, both prior to and after doctoral study, and considering the value of the PhD in Indigenous health leadership and Indigenous intellectual traditions. So some of the ways that we do this is through building community partnerships, engaging with other faculties within the university, but also the schools and graduate programs within our own faculty, and supporting our students to enrol in various other programs, such as the Professional Certificate of Indigenous Research and the Graduate Certificate of Indigenous Research and Leadership. And this year we're looking forward to 6 PhD completions, which is a significant achievement for the centre. So one of the community partnerships that we've developed to support PhD pathways is the Dungala Kayala PhD Fellowship. And I'd like to acknowledge Karen, Raylene and Tui, who are our inaugural graduates of this fellowship. This is developed out of a partnership between the Department of Rural Health in Shepparton and the Poche Centre, and has been a really significant way to think about community-based PhD research and postdoctoral pathways beyond that PhD. And I'm pleased to say that in 2022, we'll have 2 new fellowships available. One of the other ways that, that we've been able to support the development and continuity for Indigenous research was to develop an Indigenous postdoctoral fellowship within our faculty. Out of our 6 graduating PhD students this year, we have 5 going on to postdoctoral research. And I'd like to congratulate Karen, Sharon and Todd, pictured here, who will be going on to take up our MDHS Indigenous Postdoctoral Fellowship, which was launched last year, and for which each of these 3 were appointed. And which is currently being called or calling out for 3 more fellows as I speak in September this year. So we look forward to having an annual intake for this postdoctoral fellowship. So one of the new arms to the Poche Centre is our research, and I'll hand over to Odette for the moment to talk a little bit about our current projects and to provide some preliminary findings of each of those.
Thank you. Thanks, Shawana. So we're currently focusing on 2 research projects that align with the Centre's 2 strategic goals. The first examines the history and development of the Centre with a focus on the role of philanthropy and Indigenous health initiatives within the university. And it will also evaluate the impact of the leadership and alumni programs, including any areas for improvement. The second focuses on our work relating to doctoral pathways. And so I'll present here some of our preliminary findings in relation to this project. So the aim of the project was to evaluate the Centre's programs that support potential and current Indigenous PhD students. And to do so, we surveyed those who have done the familiarisation program. We interviewed existing PhD students and surveyed their supervisors. And we also interviewed postdoctoral fellows in MDHS to examine potential career opportunities post-PhD. So we're really looking at how Indigenous people navigate the academic journey, what support systems they access and why, what successes and challenges they experience, and what improvements can be made to ensure the best possible outcomes for their future. So the familiarisation program has been run 5 times since 2015, and it aims to support those interested in doing a PhD through an on-site 3-day workshop. And the workshop includes sessions on the purpose of undertaking a PhD, the importance of networks and collaboration, understanding the roles of supervisors and mentors, application guidelines, as well as discussions about the opportunities and also the challenges of being an Indigenous research student. So of the 43 people who have completed the FAMIL program so far, we know of 22 that have enrolled in a PhD. Of those 22, 10 came to the University of Melbourne and 12 are at other institutions around the country. Of those we surveyed, 60% were the first to go to university in their family. Most people engaged in the FAMIL program to better understand what it takes or what it means to do a PhD, the process of applying, and also to find out if it was going to be a good fit for them. Many commented that the program gave them the confidence to apply, that it provided the information they needed to move forward. For some, it clarified the fact that a PhD wasn't quite the right fit for them, which is also a good thing. All those surveyed reported that being part of an Indigenous cohort on an Indigenous-led program was highly influential. For many, it was the reason they participated and pivotal for those who decided to do a PhD in the end. The peer networking aspect of the program was also significant, with many acknowledging the importance of engaging with others on a similar journey with similar histories and experiences. Importantly, we also gathered suggestions for ways we could improve the program, and these included having more access to current PhD students to talk through their experiences, more thorough follow-up following the course, more advice around applying for outside scholarships, tips for self-care and supervision pitfalls, and resources to deal with racism experienced in the university environment. So, as we've said, we currently have 27 Indigenous PhD students enrolled at MDHS. And as part of this project, we interviewed 9 of those. We're still in the early days of analysis of these interviews, but I can report on some findings so far. Of those we interviewed, and this is true across the cohort, most would be considered mature aged and come to the PhD having already had a career. This is important for understanding the other pressures that they juggle, including family or community responsibilities and concurrent work obligations. Many, as we've shown with the FAMIL participants, are the first to go to university in their family, and most are the first to undertake a PhD. As this slide shows, 25 out of the 27 students are undertaking projects relating to Indigenous health or Indigenous health practices. And this not only illustrates the desire of many students to give back to their communities, but highlights the wealth of knowledge being generated at this institution by these students on Indigenous health issues. While everyone's PhD journey is different, many reported feeling generally supported in their candidature, but also cited a lack of time and an inability to engage with many of the student support or professional development opportunities on offer. There were, however, some gaps in knowledge about available support opportunities, as well as a reticence to go for funding when it arrives. There were also differing experiences relating to supervisors. And while some expressed having very positive and empowering relationships, others have found those engagements difficult and lacking. Many reported a limited pool of Indigenous supervisors or supervisors with relevant experience, as well as the limited capacity of more senior academics to provide the necessary time and support. Those that have access to an Indigenous supervisor cite the importance to them of having someone with knowledge and expertise in the area, including Indigenous methodological approaches, as well as the lived experience of being an Indigenous person operating within the university environment. In terms of areas for improvement, feedback included having more opportunities to meet with and engage in a structured way with other Indigenous PhD students, possibly more encouragement to get engaged despite reports of lack of time or capacity because the benefits are worth it, more structured information about the opportunities or support mechanisms available, and an orientation process with other PhD students at NDHS starting in the same semester or the same year. So to finish, we also asked the students about what impact recruiting and graduating more Indigenous students will have on the university and the health professions. And while many expressed a sense of displacement at university, all refer to the importance of having more Indigenous researchers and graduates for those coming after them, so that they can feel as if they belong. Participants also recognise the value of Indigenous knowledge generation and the impact that this will have on both the university and the health professions more broadly. Back to you, Shawana.
Thanks, Odette. So here we have a number of our PhD students pictured, and I'd like to acknowledge the amazing research that each and every one of these and others who aren't pictured are undertaking. They're really crafting pathways through research to be the experts in their fields, and they're looking at incredibly important issues that face Aboriginal communities, Aboriginal people, and Australians in general. So things like men's health, Aboriginal men's health, family violence and how it impacts on Aboriginal women, big data and data linkage, ethics, child and maternal health and epidemiology, to name a few. So really, really critical areas of research. I'd also like to acknowledge how difficult a time it has been during COVID to undertake research. And many of our students have found this time quite difficult, but have managed to really work through it. Finally, we'd like to just leave you with this last slide, which really indicates the difference that culturally informed and bespoke support can make to the PhD recruitment of Indigenous students and the experience that they have throughout their candidature. As you can see, the numbers of enrolments of Indigenous PhD students dramatically increased at the time the Melbourne Poche Centre was established in 2015. So we'll leave it at that. Thank you very much for listening to our presentation, and I'd like to thank the organisers of the conference for allowing us the time to present a little bit about the centre, but also some of the research that we're currently undertaking. Thanks very much.